Multiple myeloma has great variability in clinical presentation and biologic characteristics. There are certain high-risk features such as translocation 414, translocation 1416, and deletion of 17p, which is uniformly accepted as a marker of worse prognosis. And these are actually incorporated in the revised international staging system for multiple myeloma. So these patients who have these chromosomal aberrations are considered what we call as high-risk multiple myeloma. And historically, these patients do poorly with treatment. They have high and early relapses and poor overall survival. It is unclear how best to treat these patients. In the last few years, we've seen that monoclonal antibodies such as daratumumab are quickly becoming an important therapy for multiple myeloma. More recent studies have incorporated them in high-risk multiple myeloma settings in newly diagnosed patients. So what we really did was try to answer the question, what is the role of daratumumab for treatment of patients with high-risk multiple myeloma? What we did was we pulled 6 clinical trials involving over 4,000 patients, of which about almost 600 patients had high-risk multiple myeloma. And we analyzed or did a systematic review and meta-analysis of all of these results across these 6 studies, pulled them, and tried to tease out that question. Our findings suggested that when we analyze patients, both newly diagnosed and relapsed refractory patients, adding daratumumab led to an improved progression-free survival, our pooled hazard ratio being 0.67 with a p-value of 0.02 with statistically significant.